Premier Ford couldn't contain his excitement.
God bless America. They're coming to our rescue.
After months of badgering former President Donald Trump and current President Joe Biden, Ford got his wish after the White House confirmed today that it's sending 1.5 million doses of AstraZeneca to Canada.
It's not fully finalized yet, but that is our aim and what we're working toward to Canada and Mexico.
Unlike Canada, the U.S. has not yet approved AstraZeneca.
I've been bugging Trump. I've been bugging Biden, all of them. They must get sick of Doug Ford asking for help. But our greatest partner, our greatest trading partner, our greatest friend in the world, President Biden, thank you.
Politicians on both sides of the border are welcoming the news. Brian Higgins, the U.S. Congressman for Western New York, says helping Canada catch up on vaccines helps reach vaccine parity in order to get the shared border open again. Last week, Higgins asked President Biden to have the Canada-U.S. border partially reopened by the July 4th weekend. This comes as the European Medicines Agency finds AstraZeneca safe. Several European countries have banned the drug out of fears of rare blood clots.
The committee also concluded that the vaccine is not associated with an increase in the overall risk of thromboembolic events or blood clots.
Additionally, earlier this week, the National Advisory Committee on Immunization determined that AstraZeneca is suitable for people 65 and up. Currently, only those between 60 and 64 have been getting jabbed. The premier gave no details earlier today on how the government would adjust.
I think it's good news that we can use AstraZeneca for 60 plus all the way up. And I think it just gives us more flexibility and more ammunition to get needles into people's arms.
So what does all this mean for people who are 60 to 64? Where the Ministry of Health tells CHCH they're reviewing this updated guidance for AstraZeneca. They add that the province has received just a limited supply of the drug to date, and the majority of those doses have already been administered or are being booked to be administered through the province's pilot program in pharmacies and primary care settings. Thus, those people aged 60 to 64 will still be getting their vaccines.